All right, this slide we are going to focus on, no pun intended, basophilic stippling. So stippling is a red cell inclusion. So I've also made a couple of other videos on Pappenheimer bodies and Howell-Jolly bodies. Now, what differentiates Pappenheimer bodies from basophilic stippling is that basophilic stippling tends to be throughout the entire red blood cell, as you can see here, whereas Pappenheimer bodies tend to just kind of be, a few of them here and there along the edge. And we can see here in this example that the basophilic stippling it covers the entire cell. Now, Howell-Jolly bodies, that would be very easy to differentiate because usually Howell-Jolly bodies are just one. But as we can see here with this basophilic stippling, they're all over the place. And usually Howell-Jolly bodies are much bigger than the basophilic stippling granules. So we would tend to see, uh, when it comes to grading these, they can be graded either, I would say that this is more on the end of being coarse basophilic stippling. You can have fine basophilic stippling and really coarse. I would say this is somewhere in the middle. And you're going to see basophilic stippling in cases of like lead poisoning or heavy metal poisoning. So lead poisoning, probably the most common patient population with that would be children. I think it's kind of a common screen for children who are maybe around or under 1 years old to be screened for lead, because oftentimes in old houses the paint is lead based, and kids, they stick everything in their mouth. So anyway, yeah, so this is a great example of basophilic stippling.